What if we could totally change the way we think about dementia care? Today, we're diving into a really revolutionary approach that does just that. It's all about a massive shift in mindset, moving away from just managing decline and toward restoring a real sense of purpose and dignity.
So let's just start with this one big question, because it really gets to the heart of it all. What if our main goal wasn't just about keeping someone safe, but about helping them feel valued, useful, and truly alive? This is the core idea we're going to unpack. Okay, so to really get why this new approach is such a game changer, we kind of have to look at the traditional way of doing things and, well, where it can go wrong.
You see, in a lot of long-term care homes, the whole system is built around tasks, getting things done for the residents. Now, it's totally well-intentioned, but it can accidentally strip away a person's control, their identity, and make them feel like life is just something that's happening to them.
And that feeling often leads to what are called responsive behaviors, things like agitation or wandering. The old model might look at those as problems to be fixed, a lot of times with medication. But what if they're not problems at all? What if that's the only way a person has left to tell us that something is really wrong? And that brings us to the origin of this whole idea, the Montessori approach for dementia. And it all started with this amazing connection between two totally different worlds.
The backstory here is just fascinating. It all starts way back in the early 1900s with Dr. Maria Montessori. She completely changed childhood education by showing that kids thrive when you give them respect, purpose, and a well-thought-out environment. Fast forward a few decades, and a psychologist named Dr. Cameron Camp has this incredible light bulb moment. Could those exact same principles work for people at the other end of their lives? And that was the question. That was the question that changed everything. Instead of just focusing on what dementia takes away, he started asking how we can work with the strengths and abilities that are still there. It launched a whole movement based not on managing disability, but on enabling ability.
So, how does this all work in the real world? Let's break down the core principles of the Montessori method and see how it's used in dementia care. Right here, you can see the whole mindset shift in a nutshell. You're moving from a place of control to a place of curiosity. Instead of just reacting and thinking, how do I make this stop? The question becomes, what is this person trying to tell me? Are they lonely? Are they in pain? The behavior is just a clue. The Montessori method is really built on these 5 pillars that all work together. It starts with number 1, respect and dignity, really seeing and honoring the person for who they are today. That foundation allows you to build a sense of purpose and belonging by creating actual meaningful roles for them. This naturally leads to more independence, which strengthens their identity. All of this is supported by the prepared environment, making the physical space a partner in care. And it's all tied together by observation and adaptation, where the staff become less like managers and more like thoughtful detectives, always adapting to what each person needs. And that idea of purpose, it's absolutely central. We're not talking about busy work here, just to fill time. We're talking about real meaningful jobs, folding the laundry, setting the table, greeting visitors. These are things that make a person feel connected, feel needed, and they restore that sense of self-worth. Another huge piece of the puzzle is what's called the prepared environment. Basically, the physical space itself can be a silent partner. It's designed to be simple, intuitive, and supportive, which cuts down on a ton of confusion and anxiety. So, what does a prepared environment actually look like? Well, it's often about really simple, practical changes that make a massive difference. Think clear signs with pictures on them to label rooms, or making sure the toilet seat is a different color from the toilet bowls so it's easier to see. Even just storing the spoons right next to the cereal bowls. All these little things empower a person to navigate their own world with more confidence. Now, this all sounds really wonderful, but you might be wondering, does it actually work? And the answer is a huge, resounding yes. The data is so compelling, this isn't just a nice idea, it's a proven, evidence-based practice. A major review from 2023 looked at 15 different studies and found consistently positive results across the board. We're talking 85% positive outcomes for resident engagement, 80% for well-being. I mean, these numbers are just fantastic. They really do speak for themselves. And check out this study from 2016. After just 1 year of training staff in these methods, they saw a 65% drop in resident agitation, a 50% reduction in the use of powerful psychotropic meds, and get this, a 40% increase in staff satisfaction. Turns out, when residents are thriving, the people caring for them do too.
So let's bring all this together. What's the big takeaway from this really powerful model of care?
I think the most important thing to remember is this. Dementia changes things, for sure, but it doesn't erase the person. Those behaviors we see are communication. The world around them can either help or hurt, and maybe most of all, giving someone a reason to get up in the morning, a role, a purpose, is one of the most powerful things we can possibly do.
And that really leaves us with a final thought. Whether we're talking about a care facility or our own families, the ultimate question we should be asking is this: how can we shift our focus from just caring for someone to helping them feel truly needed? Because that simple change in perspective, well, it could make all the difference in the world.